We are officially 2 weeks until members of Team Allied Services and you take to the streets of New York City to run a marathon after raising more than $400,000 for pediatric care at Allied Services. Now, we've introduced you to some of the runners and some of the children, too. But there are some other members of the team you may not know, and those are the residents serving patients every day right here in our area. It takes a lot of work to get ready for race day. But that preparation is nothing compared to what it takes to become one of the doctors serving patients in Allied Services Rehab Hospital, even after earning an undergraduate degree and attending medical school.
And you do anywhere from 3 to 5, typically, years of residency, and then you can do a year of fellowship as well. And then you become from resident to fellow to attending. And attending is just a full-fledged physician that is pretty much has no oversight from another physician.
These are some of the senior residents in their final months of study in the Wright Center's Physical Medicine and Rehabilitation Residency through a partnership with Allied Services Integrated Health System and Northeastern Rehabilitation Associates. There are currently 15 residents here, focusing on the movement and functionality of patients at Allied Services Rehabilitation Hospital.
As physiatrists, our ultimate goal is to improve a patient's level of function, to maximize their level of independence when they're at home.
We are sometimes known as muscleologists or kinesiologists. It's just a study of movement and dynamics and how that pertains to injuries and other pathological states, disease states, and what we can do to treat them.
And if you ask these doctors why they chose to take their careers down this path and in northeastern and central Pennsylvania, they'll give you similar answers we hear from Team Allied marathon runners who chose to dedicate their time and energy to patients here.
What stood out to me were the people here. I was looking for a program that was truly dedicated in a resident's growth, and when meeting Dr. G, I saw how this was something he didn't have to do. It's something he wanted to give back to the community and to the residents.
At least here, it kind of goes beyond just the medical foundation. They teach us how to have a really good rapport with patients. They teach us how to connect with patients. And those are kind of the gold standards of how we should be treating patients in this community.
The community feeling here, the caring of the area, it's unparalleled by anybody, really. Some of the hospitals in the area have changed over the years, but Allied has been the same hometown type of environment since 1958 and on.
If you want to support the work of these doctors for children at Allied Services, you can find how to donate to Team Allied Services and you on our website, WNEP.com.